I'm Jake Janser. I'm from Minot, North Dakota originally, but now I live here in Brookings.
I'm Amanda Janser. I'm originally from Southwest Minnesota, but we've been living here in Brookings, South Dakota for going on our 5th year.
Amanda and I teach at the university. I teach sociology.
And I teach psychology in the same building. We have a little wonderful boy named Maxwell Janser, who is 21 months, so almost 2 years.
And then we have one on the way that's due in June.
To me, it was just having another person there who could also give Jake a break, because maybe you need to go eat or go get something. I just think it takes a toll on both of us, and so to have another person there, I think is helpful. And another person there with ideas about how to manage pain and how to get through it. Someone who had attended births as we had not.
She and I felt like at all times were on the same side. We were both there to look after Amanda and try to help or contribute to her progress through labor as much as we could. And she was very helpful to me in ways like, you know, helping me, like kind of keeping track of my well-being, like did I need anything, or had I had a snack, or had I had a drink of water lately. And so when it comes to participating, I really got to participate as much as I wanted to in terms of, you know, providing support, or just if what Amanda wanted was to hang back, then that's what both the doula and I would do. But I never felt like she got in between me and this process that we were going through. I really felt like, you know, she was a partner or a helper, and definitely not someone who got in the way of my participation.
In terms of a fear that like the doula would get in the way of the partner or of the father, I mean, I very much felt like Jake was my primary support, and the doula was a secondary support to both of us. But I certainly never felt as though she got in the way of the two of us, certainly. But that she was really a supportive person there for both of us.
Especially for first-time fathers who haven't gone through the process of labor and delivery, it's extremely helpful to have that doula there, somebody who has seen many births and who, because it's such a strange situation that is very outside of your normal experience, having somebody there who is a constant and very even-keeled and level presence throughout that whole process, I think helps everybody involved. Especially when you know, your partner who's giving birth is not interested in processing the mental and emotional experience that you're going through right then, because she's really going through it and you're kind of watching. And so having another person that you can turn to who has their sense of humor intact, and who you can even make eye contact with, like if something, you know, if the nurse is writing something on her clipboard or looking at a gauge or a meter on something, and you can kind of make eye contact with her and be like, is this, you know, is this normal, or is this what's going on? And she'll just be like, yeah, it's fine, you know, or whatever. That's really helpful because, you know, normally, I mean, at least for us, normally your partner would be the person that you would try to process all of that with, or who would be your partner in a situation like that. And you can't rely on them to do that, obviously, because they're too busy having a baby. And it doesn't cost you anything, and I can't imagine it could possibly hurt. And so I think you'd almost be crazy not to get one. It would be what I would say.